As you see, John is in his full PPE. He's coming out of the room. We're going to talk about doffing. Now, when we talk about donning and doffing, putting stuff on, and doffing, taking it off. The doffing and the taking the protective equipment off is the most important, because this is where most of the cross-contamination happens in taking off that equipment. As evidenced by several other events throughout the U.S. In regards to Ebola and stuff like that. Now, a little bit into my background, I have spent several opportunities of training around the country, most specifically at the Center for Domestic Preparedness in Anniston, Alabama, where we've actually worked with sarin and VX nerve agents. We knew when we had to doff our PPE, we had to do it correctly because our lives depended on it. Okay, I've worked with some of the most deadliest chemicals on earth, and we knew again that we had to take that equipment off in a very systematic way. It wasn't anything that was quick. It was very deliberate to ensure the safety of all. So John's gonna show you how to take off the equipment that we have.
Thanks, Jason. And absolutely so important. In the real world, when you're in a hurry, it's easy to lose focus of paying attention of exactly doing it correctly and doffing, okay? If you do happen to touch your hands or something, there's no need to panic. You just sanitize your hands when you come out. The main thing is to be conscious of what you're doing.
Correct.
Okay. So, per our policy, we doff everything in the room and put it in a trash can, a covered trash can, except for the N95 and the eyewear, which is done in an established anti-area, either a table outside of the room or a separate room. Okay? So now the first thing that I want to do is take off my first set of gloves, because you remember I am double gloved. I take off the first set of gloves and throw them away. I take foam. You either have foam ready or you have a dispenser or some kind of alcohol-based hand sanitizer, Purell, whatever. You put it on the next set of gloves. You foam those gloves. Now you're ready to doff your gown. It's tied at the waist and the neck. It's best to do it in a two-step process. Breaking the waist, grabbing up here, snapping the neck, and then you want to be careful. Turn your hands outside like this as you work the sleeves down. So I'm not touching the inside, I'm still only touching the outside. And I am starting to roll this up, only touching the inside at this point. Then here, this is the inside of the sleeve that I'm taking this thumb. I'm going down my wrist into the palm of my hand and doffing the glove inside the sleeve. This sleeve, I carefully made sure my gloves were over the sleeve, so as I stick my bare thumb in here, it's going from the inside of the sleeve to the inside of the glove, and I'm doffing it inside the sleeve once again, throwing it away, okay? I want to take my simple mask off by not touching the front, only touching the straps on the ears, throwing that away. Then I want to step outside of the room to my designated area, okay? You take off the goggles the same way, and again, this is either way, if you feel more comfortable to put on a third set of gloves to take these off, or just sanitize your hands after, either way is acceptable. But I take my goggles off, I put it in the designated anti-area just by grabbing the elastics, and the same with my N95, I am only grabbing the elastics, taking that off, putting it in my anti-area, foaming my hand again, and then follow your hospital's policy for storing the masks, which will give suggestions, and cleaning your protective eyewear.